Dear Ugandans, we send you greetings from the Uganda Medical Association. My name is Dr. Robert Lubega, and I am the national leader of the senior house officers and fellows. Senior house officers and fellows doing their postgraduate training to become specialists. Gynecologists, orthopedic surgeons, neurosurgeons like her in training, physicians, pediatricians. Yes, so over the past, since 2017, the president of this country, His Excellency Yoweri Museveni, came up with a resolution to have SHOs, those are senior house officers, paid. And since that time, we have been receiving an allowance. And we thank the President and the entire Ministry of Health and Education, Health and Finance for these steps. However, we received a very disheartening message, which was not signed, it was an official, directing the directors and directors of the different SHOs and internship training centers to hold payment for these categories of people. The first category of people is the fellows who are postgraduate trainees under the COSEXA, and those together with us doing the Masters of Medicine serve Ugandans equally. The other category of people was the refugees. These colleagues come here and they work with Ugandans in the same conditions as us, and they're being paid for a long time. But that message highlighted that these people should actually be removed and scrapped from these payment schemes. The other category was the people who are actually doing their master's programs and they have been on government payroll. These people have also been scrapped. However, we note that we are receiving an allowance, a stipend for the services we offer to Ugandans. And therefore, it is unfair for the Ministry of Health to come out and scrap these colleagues who toil day and night to save Ugandans' lives. So we are kindly calling on the Ministry of Health and Government, the Permanent Secretary, the Minister of Health, to come out and meet us. And we have an explanation for this unfair treatment of our colleagues. Thank you.
So senior house officers who are affiliated with COSEXA. COSEXA is known as the College of Surgeons of East, Central and Southern Africa. We have two categories of residents. The general surgery residents, denoted as members of College of Surgery, MCS, and then those doing the fellowship program where they're actually super specializing in different specialties, like urology, which deal with the diseases of men, orthopedic surgery, who deal with the diseases of bones and the spine, neurosurgery, who deal with the diseases of the brain, and others. We have been marginalized by this memo that was released by the Ministry of Health, as we have been informed that payment will be ceased effective July this year. I would like to let the entire medical fraternity and the world at large know that these residents have been working 24 hours. They have been receiving a stipend of 1 million. This 1 million has been insufficient, but it has been an endorsement from government that our work is being recognized. Now that the 1 million has been struck off, it leaves us wondering how to earn our livelihood. We work 24/7, we even meet in the corridors and laugh at 2 a.m. Weren't you asleep? And then somebody tells you, no, at home is where I keep my bed. I live here. That shows you how dedicated we are to working. Without this stipend, it's going to push us to have to look for other means of livelihood, seeking jobs in private care, which we cannot do because we work 24/7, 365 days of the year. We appeal to Ministry of Health and the government officials to allow for us to have this meeting, to dialogue and to rectify this issue. This will also help in strengthening surgical training within the region, and we hope for positive feedback. I'd also like to convey that we're still committed to carry out services, emergency services, surgical care, as we wait for this dialogue with Ministry of Health. Thank you very much.
The country, so we're not doing this behind him. He's aware, and we are all in sync with this. When one part of our fraternity hurts, we rally behind that one part. The interns whose money has been scrapped, they form the first step of medical practice. They are the foot soldiers, they are the ones who see all our patients first and foremost. And so they are fully dedicated. This allowance which was given to them is to take care of their housing, their airtime, their feeding, and everything, really. And SMIGA, 1 million Uganda shillings, it's been scrapped. The SHOs who are doing masters, these are the first level of specialization. I'm a consultant. I've been a consultant for the last 6 years, and I've been an associate consultant since 2009. I know what an SHO does. I was an SHO in 2000. That's about 25 years ago. I know what an SHO does. They are the first line of the specialized services. They are on the wards 24/7. We even had a phenomenon called the leftovers. If a patient is not done during your shift, the next day is frozen. You must do this one. So they cannot afford to run around look for money or means of survival. And that is why the government, in its wisdom, chose to give this allowance. So our first question is, we received the notification, but just by WhatsApp. It's not signed, it's not headed. So we really want to seek the guidance of the Permanent Secretary Ministry of Health to tell us, is this just rumor, is it true? Unfortunately, it's already being effected. Some people have not received their money. And then we want to look at the rationale. Why? Why are these people scrapped off? Refugees who are millions of miles away from their home and are here for very unfortunate reasons, but are serving the country in the same way that Ugandans are serving, being served. Third, we also want to know why, when money is going to be withdrawn, why do it suddenly? Why not engage the people whose money is going to be cut, give them a 3 months notice, if there is justification, that is, give them a 3 months notice, let them look for alternative sources of livelihood, and then they can patch up. So really we want to seek audience with the Permanent Secretary and the Ministry of Health. First of all, understand and seek guidance, and that's why Uganda Medical Association is rallying behind the affected doctors to see the way forward. I thank you. That there are some emails which have gone out to the directors of the regional referrals, the internships, training centers. It's basically a big rumor. That's not how things are done in government. We communicate officially, we dialogue before, we engage, we warn, we prepare people before we act. And these are young people. These are people who are dedicated.